Here in Seoul, we're breaking into our regular programming to bring you a live briefing from the South Korean health authorities. We'll be cutting straight to the site of the briefing in just a moment with interpretation in English as soon as that starts. Now, in the meantime, some updates. South Korea, according to the latest figures, has recorded one more death from the coronavirus outbreak, bringing the death toll to 50. The 50th death was at a nursing home in Gyeongsang-Buk-do province, not far from Daegu, the center of the country's outbreak. A 78-year-old woman tested positive Thursday at the nursing home and was moved to a hospital in the city of Gimcheon for treatment, but died Saturday afternoon. The number of confirmed cases in South Korea is now at more than 7,100. That's with Saturday's increase of 367. Now over to the briefing.
Let us now begin the regular briefing on COVID-19 outbreak for today. As of midnight today, March 8th, the total number of COVID-19 confirmed cases increased by 367 from the day before and stands at 7,134. And of them, 130 have been discharged following full recovery. And we have an increase of 6 more fatalities compared to the day before, and this accounts to a total of 50. I send my deepest condolences to those who have died as well as their bereaved families. And the following is the breakdown of the outbreak by region. In Daegu, we saw an increased number of the confirmed cases, and the total number in Daegu stands at 5,378. And in Gyeongbuk, it stands at 1,081, and a combined of Daegu and Gyeongbuk stands for 90.5% of the total outbreak. And most of the outbreak were from the contacts of the Shincheonji members as well as the group cluster infections. And this is the same for Daegu and Gyeongbuk region. And nationwide, 79.4% are related to group clusters, and rest of them are sporadic outbreaks, which account to about 26%. And as we carry out continued investigation, we can track the movement and the outbreak of the virus. In Daegu, there was the residential apartment of Hanmaeum in Dalseogu, and we have confirmed 46 confirmed cases there in the single apartment. And of the 140 residents, about 18 have been confirmed positive, and we are still conducting tests for them. And in Gyeonggi-do province of Bundang, we have 13 confirmed cases in the Bundang Jaeseng Hospital, and this includes the 6 people who are the inpatients of the same building, and we are currently conducting epidemiological surveys for these people. And currently, we have put those confirmed cases on quarantine for 1 person per single room, and we also recommended self-quarantine for those who need future investigations. And our CDC headquarters has analyzed the results, and we identified that group cluster is being identified, ranging from religious groups and social services facilities as well. So we need to increase and intensify our measures to counter this outbreak. And I urge all of the municipalities to have an emergency contact network so that we can be fully prepared for a possible outbreak. Each of the facilities need to designate an employee who can be in charge of the emergency contacts, and this person needs to monitor any of the suspicious symptoms of COVID-19 so that appropriate measures can be taken as soon as possible. Moreover, those who are working at these facilities, I ask them to keep their personal sanitary measures. For those of you who are working at these social facilities, we urge that if you have any symptoms of respiratory symptoms or fever, please do not go outside and please visit the screening centers as soon as possible. As we mentioned to you earlier, we believe that the COVID-19 outbreak, the virus is spread through hand touches, so we please advise you to wear masks if you are working at these group facilities. And if you have any symptoms of fever or suspicious symptoms, we urge that these facilities need to report to the central government on any of the developments. And the central government, we highlight that social distancing and complying with the personal sanitary practices is very crucial. As we reiterate, we believe that the virus is spread through human touches, and in order to minimize any future infections, we urge you to distance about 2 meters from people when you come in contact, and if you sneeze or cough, please cover your mouth with your sleeves. And if you have any symptoms of respiratory symptoms, do wear face masks. And we also highlight the importance of social distancing. And another aspect is the spread of the virus through hands. So we urge you, and we highlight the importance of washing your hands thoroughly with soap. Moreover, if you touch anything surrounding you, please do not touch your face, including your eyes, your nose, or your mouth before washing them clearly. So please remember this as you carry out your daily lives. And third is wiping and keeping the surfaces clear. So this is one of the preventive measures that you can take on a daily basis. So we highlight this once again. That's all from me. Thank you.
All right, and that concludes this briefing. There's another one, though, scheduled at 5:30 p.m. local time, which will also carry live. Do stay tuned to Arirang TV for the latest on the outbreak in South Korea. We'll be back in just a little while.